So one of the most important consequences of moderate or severe acne is acne scarring. And this comes about because the acne lesions cause severe inflammation in the skin, causes damage to the dermis and the extracellular matrix of the dermis, and by causing this damage, it triggers scar formation. When a scar's flat and smooth and the same color as the skin surface, we don't notice it, but the scars which we tend to notice is the dipped scars. The medical word for this is atrophic scars, or lumpy scars, or scars which are different in colour. So first of all, talking about atrophic scars, and this really is probably the mainstay of the scar type that I would treat for acne scars. There's different classifications for these dipped scars. They can be classed as box scars which have a sort of a square shape, rounded rolling scars, or very sharp, deep ice pick scars. Of course, actually in reality, every scar is different. There's a lot of overlap, and many scars don't fall neatly into one of these boxes. Now, firstly, talking about treatments for the sort of deeper scars, really the goal is to build up the volume. And this can be achieved through lots of different approaches. One approach is to use TCA cross, which means using trichloroacetic acid to cause a chemical injury to the base of the scar, stimulates the body's natural wound healing response, and then the scar can build itself back up again. Another option is to use subcision, where we're using a needle underneath the base of the scar where it's tethered down, releasing the base, sometimes even putting a little bit of filler in just to boost it back up again. Another option is to do a punch excision. This is really good when you've got very deep pitted scars. You can remove a core of tissue around the scar, and that enables you to then restitch, replacing the deep scar with just a very fine scar, which is less noticeable. And this brings me on to a mainstay of treatment for atrophic acne scarring, which is laser treatments. And broadly speaking, there's two types of laser. The first is the fractional ablative laser, such as the carbon dioxide laser or certain erbium lasers. These are causing columns of injury to the surface. By fractional, we mean that rather than treating the entire surface of the skin, they're drilling little holes and treating a fraction of the skin. This stimulates the body's wound healing response, the skin's natural healing, which can boost up the scar, it can even the texture, it can stimulate new collagen formation. Ablative lasers do have some downtime, and they do have some risks. And for some patients, particularly those who may have pigmented skin types where the risks are a little bit higher, another good option is non-ablative fractional lasers. So they're doing a very similar thing, but they're causing their injury just in the deeper part of the skin rather than on the surface. That means that the downtime is a lot less, the risk is a lot less. Now, you're probably not going to get quite as much improvement, but it's a lot safer, and many patients do prefer these. Now, that brings me on to the second type of acne scar, which is the lumpy scar or hypertrophic scar. These are quite challenging to treat, but usually we'll use a little injection of steroid to try and flatten them, and just go very, very cautiously. And then finally, we talk about scars which are different in colour. So often patients might come because the scar is redder, because it's pigmented. And both of these things will usually resolve with time without treatment, but they can also be treated with laser treatments such as vascular lasers or pigment lasers.